first of all, the spiraling costs. And these are costs that are hitting everybody, not just employers, not even employees, but everybody, all families across the country. So cost is probably the big thing, and it's really going out of sight. And then the other two, of course, are the huge numbers of uninsured that we have in this country, and then the quality of care that in many cases is actually going down.
You know, if you focus on people that are uninsured, you deal with cost, quality, and access in one fell swoop. You know, it's a significant problem for people who are uninsured, and it's also a growing problem. So we really need to find ways to deal with that problem, I think, very early on in our healthcare reform efforts.
The issue of conscience is the issue of how many people can't afford to get health care coverage and are uninsured or underinsured. I think if you ask the American public generally would say the costs of health care is what concerns them the most. So I think those two issues need to be wedded together. They're obviously related to one another. And so dealing with costs and dealing with access, I think, are the most critical thing that we need to do.
Remember that people who come to a doctor in the office are often the people with insurance. Those who don't have insurance don't even go there because of concerns about cost. So the problem is we end up seeing them, but we see them late. We see them in the emergency room. We see them when the condition has worsened to the point where either it is unable to be helped or it takes much more expensive therapies or hospitalization to solve it. So we see it all the time, and we still see people dying of preventable conditions like cancer of the cervix because a woman didn't have a pap smear in time. It just doesn't make sense, and frankly, we need to switch that. We need to make sure we cover all Americans.
Frankly, they also see a trend that has started really in the last 2 or 3 years, where they see a great deal of change in the health benefits people have who have coverage with much higher deductibles. And whereas some would hope, I think, that those deductibles would lead to more cost-conscious purchasing on the part of patients and consumers, instead, what the hospitals see is that many of these people are willing to come into the hospital. Obviously, the insurance pays for part of the cost, and then the hospital is left with an unpaid deductible. And this is a very large problem because they're receiving services and they have coverage for part of their care, and they're not paying for the other part. So this issue of unpaid, uncompensated care is a growing one. And at the end of the day, someone has to pay for that. And the paying patients, or either those covered by Medicare or those covered by private insurance, are paying that extra cost. And it leads to all kinds of incentives that are problematic and cross-subsidization and increases in everyone's premiums who are paying premiums. And something's got to give here.
The issue is, would a patient come to see me earlier in their disorder? Would they come to see me for the preventive care that they need? That is the goal, to make sure that people get the care they need when they need it. We think that that will make a difference in the economics of health care.
It's not just cost. I mean, although cost is big, in a period when wages have been stagnant, the cost is more serious than it's ever been. But access and quality are significant concerns of working people and their families.
I think they most come down on the cost side of the equation, and it's essentially because Medicaid has been growing 11% per year over the last 25 years. It's now 23% of state budgets. If you add state employees and other healthcare costs, it's probably a third of state budgets. So it essentially equals what you have in terms of education. And unfortunately, we're at the point now that the extra revenues either go into education or into healthcare, but they can't go into both. And so as we move forward right now, this continued cost increases in healthcare are putting a lot of pressure on education budgets.
A physician came up to me on the West Coast and said, your message is so powerful because I can see myself in it. And we got onto this because we have a call center that's open 24 hours a day, 7 days a week, and people are calling us saying, I've got cancer, I've got insurance, but they won't cover what I need. We looked into it, and sure enough, many people can't get the coverage, can't get the care they need because their insurance is inadequate. Either the copays are too high or it won't cover what they need. So we estimate about 100,000 families went bankrupt last year just because of a cancer diagnosis and lack of adequate coverage.
Well, first of all, as you undoubtedly know, an individual attempting to purchase health insurance on the individual market who has a pre-existing condition like breast cancer, it's not a matter of not being able to afford health insurance. It's a matter of being able to get it at all, at any cost. There has to be some protection because while individuals have to take responsibility for their own health, and we all need to do that, we need to address as a nation the issues of smoking, of risky choices, of what we eat, do we exercise. Those are things that we have to take responsibility for and have to have more of a conversation about. But having said that, there are many health conditions that personal responsibility is not the issue. It is an accident. It is an accident that someone develops cancer. It is not always due to smoking. So we can't penalize people who, through no fault of their own, have a bad condition that has made them essentially uninsurable at the present time.
What we now see is that more people are dying because of lack of insurance. What we also know is that in our National Cancer Database that we co-founded with the American College of Surgeons 25 years ago, we can track whether a person has insurance or not, and their stage of diagnosis and the outcome. And what we have found out is that a woman without health insurance with stage 1 breast cancer is more likely to die than a woman with stage 2 breast cancer with insurance. So we know it's not just the early detection piece, which is very important, but it's also the treatment you get depending on what the quality of your health insurance.
Number one concern for small business has been the access to quality, affordable health care. And small businessmen and women across the country have told us this for the past 20 years, that they want access to quality, affordable health care. And fundamentally, it's around cost.